If I was sitting on Lindsay Clancy's jury right now, I would still have way too much reasonable doubt to convict. Because on day 10, Kevin Reddington ferociously cross-examined Dr. Jennifer Tufts, Lindsay Clancy's psychiatrist, in which he went down appointment by appointment, medication by medication, symptom by symptom, all to ask the same question: at which point should any of this have raised a bigger alarm? And I agree. So let's get into it. Let's start with a quick recap from Friday. Dr. Jennifer Tufts was Lindsay's outpatient psychiatrist beginning in September of 2022, and the Commonwealth walked us through months of treatment for significant anxiety, depression, and persistent problems with sleep. Lindsay was knowledgeable about her symptoms and medications. She was able to advocate for herself, and the goal of treatment was essentially to reduce those symptoms and get Lindsay functioning and feeling like herself again. But something important remained consistent throughout Tufts' testimony. She did not observe Lindsay experiencing psychosis. Lindsay repeatedly denied current suicidal or homicidal intent, and although Tufts considered other diagnoses along the way, including bipolar disorder, she did not believe Lindsay met the criteria. Even on January 23rd, the day before the children died, Lindsay appeared depressed and anxious, but appropriately dressed. Her speech was appropriate, and Tufts testified that Lindsay gave her no reason to believe she needed to be involuntarily hospitalized. On Friday, I understood Dr. Tufts' perspective, although I definitely had questions. And I had a feeling that once we got to cross-examination, a lot of those questions were going to be challenged, and oh boy, were they. Reddington started by challenging how much Tufts actually knew about the patient sitting on the other side of the screen. Every appointment she had with Lindsay was through telehealth. She never saw Lindsay in person during the months she treated her. Tufts testified that she considered Lindsay honest and forthright, but Reddington asked whether psychiatric patients sometimes minimize their symptoms. She agreed that they can. And that's important, because Reddington spent much of this cross reconstructing Lindsay's condition, using Tufts' own medical records, particularly the symptoms Lindsay was reporting while Tufts was making decisions about her treatment. One of the first medications he targeted was Zoloft. Tufts prescribed Lindsay 25 milligrams of Zoloft in September, with instructions to eventually increase the dosage to 50 milligrams. Reddington asked whether she discussed potential side effects, including suicidal ideation. Tufts explained that the increased risk she was referring to applied specifically to younger patients. Reddington immediately pushed back. Is there a black box warning on Zoloft? Yes. He then essentially asked, if that risk can exist in someone who's 23 or 24, are you saying it's impossible for someone who's 27 or 28? Tufts responded that the research doesn't demonstrate that. Then Reddington moved to sleep, because Lindsay already had significant problems sleeping when she first came to Tufts. He questioned why she would prescribe a medication that can itself affect